Insertion of a peripheral venous access IV infusion. Intravenous therapy or the IV therapy is the giving of liquid substances directly into a vein. It can be intermittent or continuous. Intravenous route is the fastest way to deliver fluids and medications throughout the body. First, we will check for the doctor's order for the administration. This is to ensure safe and accurate IV administration. So, let's check the patient's chart. Private room 3, patient Stephanie Sarafica, 18 years old, birth date September 22, 2003. So, the diagnosis is risk for electrolyte imbalance, hyponatremia related to diarrhea. So, the doctor's order is start an IVF, 1,000 ml of sodium chloride, 0.9% at 100 ml per hour. So, the purpose of administration is fluid and electrolyte replacement. Okay, so after checking the doctor's order, now we will gather the equipments at the bedside table. So, here are the equipments for the procedure. This is to save time and to have ease during the procedure. And next, you'll perform hand hygiene and put on the PPE or personal protective equipment. So, assume that I've already washed my hands. And now, I'm gonna put on a face mask. Okay, so the rationale for this is to prevent contamination and transmission of microorganisms. Then, after that, let's check for the patient. So, good morning, ma'am. I am Mika, your nurse attendant for today. Can you state your name, ma'am?
Stephanie po, ma'am.
And your birthday?
September 22 po, 2002.
Okay, so let me close the doors to provide you privacy. So, kamusta naman po ang pakiramdam ninyo, ma'am?
Okay naman po, ma'am.
Okay, so, ilang beses na po kayong nagbawas mula kaninang umaga?
2 beses po.
Okay, 2 beses. So, base po dito sa patient chart ninyo is meron ka daw pong diarrhea. Kaya si Doc nag-order na mag-administer sa inyo or magbigay sa inyo ng sodium chloride. So, ito yung solution natin. This will prevent you from dehydrating at to restore your fluid loss and electrolyte loss. Okay, ma'am. So, para sa procedure natin, ma'am, i-explain ko po sa inyo is mag-insert po ako ng needle, this one, which is called the cannula. So, i-insert ko to sa inyong vein at i-attach ko po yung tubing dito sa ating catheter. At yung tubing po na yun is naka-attach din po dito sa ating solution at dun po mag-flow yung solution. And yung other medication nyo po is idadaan po natin through dito sa IV solution natin. So, na-try nyo na po bang ma-admit noon, ma'am?
Opo, ma'am.
Okay, so, hindi naman po kayo takot sa injection?
Hindi po.
Okay. So, kung ganun, ma'am, it's good. Let me excuse myself. I'll just prepare the IV solution and the IV set. Okay, ma'am? Preparing the IV solution and administration set is spiking. You will need to attach a tubing to the bag in order to infuse the solution or medication. This is called spiking the bag. Priming. It refers to placing IV fluid and IV tubing to remove all air prior to attaching the IV tube to the patient. IV tubing is primed to prevent air from entering the circulatory system. So, remove the outer wrapper of the IV solution. And then, let's check the expiration date. Then, we will put on a label.
Para saan po yung label, ma'am?
So, ito pong label, ma'am, nilalagay po natin ito sa may solution container natin para makita ng ibang nurses kung ano po yung na drugs added or yung mga medicine na naidagdag dito sa ating solution. Okay? Then, you will put on a time strip. So, the time strip allow a quick visual reference to check for the accuracy of the infusion. So, the label indicates the patient's name, date of administration, time, the initial of the nurse, and time started, and also the drugs added to the solution. Okay? Then, we will open the administration set using aseptic technique to prevent contamination. And then, we will close the clamp. Okay? Then, we will put on a label. So, this label will indicates when will the IV or administration set can be changed or will be changed. Okay? Then, we will remove the cap of the spike. So, let's hold the IV container invertedly. So, avoid touching the entry site to avoid contamination. Because if the IV set or the IV solution will be contaminated, we need to discard and you will get another or a new IV set and IV solution. So, we will insert the spike at the entry site using a pushing and twisting motion. Okay. So after inserting, we will hang the container. Then we will squeeze the drip chamber to allow the fluid to move inside the drip chamber. Okay, so fill it up to the half of the drip chamber. Then after that, we'll open the cap at the end of the tubing to prime the tubing. So, we'll prime the tubing until the air bubbles disappeared, which can cause venous air embolism. So, and wait until the tubing is filled with IV solution. So, let's open it. Okay, so observe if the air bubbles disappear. Then close the end cap and close the clamp. Then you will reserve it for later use. Okay, so let's move on to the next procedure with inserting a peripheral venous access to allow administration of intravenous fluids, blood transfusion, chemotherapy, and other medications. So, kamusta ang pakiramdam mo, ma'am?
Okay naman po, ma'am.
Okay naman, kinakabahan ka ba, ma'am, sa procedure natin para ngayon?
Hindi naman po.
Okay. Pwede po bang upo muna kayo saglit? Dagdagan ko lang itong unan ninyo. Para sa comfortable position ninyo during our procedure. Ayan, so comfortable po ba kayo?
Opo, ma'am.
Sa position mo? Okay. So, pakipatong na lang kamay niyo, ma'am. Okay. Ito pong procedure natin ngayon, ma'am, is hindi hindi naman po yung pang matagalang sakit. Pag naipasok ko na po yung needle, is wala ka na pong mararamdaman na sakit. So, ayos po natin ito. Okay, ganyan. So, open the extension tubing. Then, wipe the opening or the open cup. Okay. So, make sure that the end cup is, or the end of the tube is cup or closed cup. Then, attach the 2 ml saline solution. Okay. And then, flush it until the saline or the tubing is filled with the saline. Okay. And then, we will reserve it for later use. Okay, so, let me observe your hand, ma'am. Okay, so if the patient is hairy, we will shave the entry site because hair can harbor microorganisms. Okay, so let's put on gloves. This is to prevent contact to blood or body fluid and to prevent contamination. Then, after putting our gloves, we will put a tourniquet 3 to 4 inches above the entry site. Kaba po muna, ma'am. Kamay. Relax mo lang po yung kamay mo, ma'am, ha? Okay po. So, lagyan kita ng ganyan, ma'am, para makita ko yung vein or yung ugat na tutusukan ko. Okay? So, try mo nga pong i-close and open yung fist mo. Ganyan. Okay. So, lilinisan po muna natin na, ma'am, kasi yung mga bacteria or microorganisms na nandyan is pwedeng maisama sa needle at pwedeng sumama sa daloy ng dugo ninyo. At pag ganun yung nangyari, is magkakaroon ng problema. Okay, so you'll clean the entry site at least 30 seconds. So we start at the center, which is the entry site, and around the entry site. Then discard. Then allow the entry site to be dry completely. Then after that, we will hold the skin 1 to 2 inch below the entry site. Ayan. Para hindi lumihis yung ugat kapag tutusukan na natin ng catheter. Okay, so let's start. Lang po. Remove lang natin yung cup. Okay. So, for the insertion of the catheter, the bevel of the needle must face or should face upward. And for the insertion, for the first insertion, the catheter should be at 45 degrees. Okay. Then, if we insert it, the catheter should be at 10 to 15 degrees. Okay? So, we will advance the device until the hub of the device is at the venipuncture site. Okay? Then, we'll remove the tourniquet. So, let's attach the extension tubing. Then we will flush. And, of course, observe for the leakage or leaking and the infiltration. So, masakit ba, ma'am, yung kamay ninyo?
Hindi po, ma'am.
Hindi. Okay, good. Okay. Then we will put on transparent dressing. So, I have no transparent dressing, so I'm gonna use a micropore or a plaster. Okay.
Dami pa lang nila.
Then after that, we will loop the extension tubing near the entry side. And then we will clean the entry cup. And attach then we will attach the IV or administration set. Okay, and after attaching, we will loop and anchor it with tape at near the entry side. Then after putting or attaching the administration set to the extension tubing, we will put on the label of the dressing, which indicates the date of the insertion time, the site which is the dorsal metacarpal vein, and the size of the catheter, which is 24 gauge. Okay? So, I will remove my gloves. This is to prevent contamination. Then, discard it. Okay. And then, we will open the clamp and adjust the flow or the flow rate of the solution. So, may masakit po ba sa kamay ninyo, ma'am?
Wala po, ma'am.
Wala, okay, good. So, maglalagay po ako ng ganito. Paki-open po muna yung kamay niyo, ma'am. Okay. So, lalagyan po kita ng ganito. Ito po yung tinatawag na skin para po hindi magkaroon ng bleeding or hindi po magalaw yung ating catheter na pwedeng mag-cause ng pagdurugo. Kung nakikita nyo po sa ibang mga patient ma'am na merong dugo dito sa part na ito, it's because na igagalaw nila yung kanilang kamay. So, lalagyan kita ng ganito to safeguard the site and of course to prevent bleeding. So, pag igagalaw nyo yung kamay nyo ma'am, dahan-dahan lang po para iwas yung sa paggalaw ng ating catheter. Okay ma'am? Hindi pa kailangan po yung ano. Okay, so, gusto niyo po bang humiga, ma'am? Or umupo na lang po?
Higa na lang po, ma'am.
Okay. Pwede niyo na pong ibabadyaan yung inyong kamay. Ganyan, dahan-dahan lang, ma'am, ha? Sa paggalaw, okay? So, punta po muna ako sa labas. Magdo-document lang po ako ng procedure natin for today. And also, huhugas ako ng kamay, okay?
Po, ma'am.
So, assume that I'm done washing my hands and I already removed my face mask or the PPE. Now, let's return to the patient's room. So, we need to return to the patient's room after 30 minutes or return early to check on the patient. So, kamusta ma'am? Kamusta po ang kalagayan ninyo? May masakit ka po bang nararamdaman dyan?
Wala naman po, ma'am.
Okay, check ko lang po yung flow rate. Okay, so we need to adjust the clamp until we achieve the ordered flow rate of the solution. So, check ko nga po yung kamay ninyo, ma'am. Wala naman po kayong nararamdamang masakit dyan?
Wala naman po.
Okay, good. So, ma'am, kung may kailangan po kayo or kung masakit o kaya merong bleeding, pwede nyo po akong tawagin. Nasa nurses ward lang po ako. Pwede nyo po akong ipatawag sa bantay ninyo. Kung meron pa man pong maramdaman na pananakit or whatsoever dyan na hindi normal, is pwede po natin yan tanggalin at ilipat sa kabila. Okay po? So, wag po masyadong igalaw ang kamay para hindi po matanggal yan at hindi po dumugo. So, I need to excuse myself. Just call me if you need something or you have queries. Okay, ma'am? Okay, pagaling po kayo.